viewers, welcome to another phenomenal episode of Dr. Kamini Rao's Masterclass. Little things are infinitely the most important, and so I say significant things are not done by impulse but by the tiny efforts brought together, and that's very important. The little things, yes dear viewers, the little things put together are important to make big things work. By starting small, you can attain big results. On that note, I open this session with a very special guest on board. Viewers, his great vision to grow and the foresight to anticipate future has made him extraordinary. But that's not all. Besides being a doctor, he is also an author and has written a book titled The Power of Love. A doctor and love, does it go together? Of course it does. Doctors also give you the power of love because that causes a lot of healing, and his enthusiasm and leadership skills have played a major role in transforming an eye clinic into a multi-speciality eye hospital, now ranked as the best eye care provider in Karnataka. Known for his yeoman services in the field of ophthalmology, he has been conferred the prestigious Kempegowda Prashasti, Rajyotsava Prashasti and Times Health Care Achievers Award as the legend in ophthalmology, and the list of his achievements goes on and on and on. About 6 decades back, he started his academic journey from the Baldwin's Boys High School and graduated from the Bangalore Medical College. Today, he is the founder, chairman and managing director of Narayana Nethralaya Eye Hospital. Welcome to the show, Dr. K. Bhujang Shetty. It's always a pleasure to have you. I've had my entire family being treated by you. Thank God. They always say with a gynecologist you can treat with 1 uterus, but you've got lucky 2 eyes to treat. So you see 1 patient, you've got 2 patients there. So I would love to tell you that the entire family trusts you with their eyes, which is a really great thing. And thank you to be on this show. And I've always looked forward to hearing from you, not only as an ophthalmologist, but as a person extraordinary. The reason I say this is not only being an ophthalmologist, you've always been an administrator, a visionary. You've been able to educate so many young students over there. And having come into your center many times, I found so many young girls there who look almost like out of college, and yet they're all MSs in ophthalmology and doing such wonderful work. And I think teaching has been a passion with you. So how did you get into ophthalmology?
Thank you, Kamini, for having me. And I must say that it's been an honor treating your family. And as far as ophthalmology and medicine is concerned, I must confess that I am a doctor by accident, leave alone being an eye surgeon. I want to tell you that I was born in a small village called Narayana in Kundapur Taluk, born in 1953. And my parents were, my father was an agriculturist, and we were a small family just managing life there. But I enjoyed those 10 years, I still remember. Went to school, whatever little we could study, we studied, not very serious. And my father also had a small kirana shop on the roadside. I used to spend a lot of time there. But my uncle, my father's elder brother, Charmaki Narayana Shetty, an enterprising person, at that stage he had the guts to walk out of the village. See, we villagers don't have, we are comfortable within our own village. We are afraid to go out of the village, out of our comfort zone. But he did. He did small time contract in near Jog Falls actually at that time. And then he had grown quite big, and he used to buy trucks after trucks for construction. And these trucks, every time he bought a new truck, he used to send it down to our village temple at Shankarnarayana temple for puja. And while sitting in that shop there, these people used to come and talk to my daddy and then move on, the drivers, the truck drivers. So I was observing this. So when I was 10 years old, it was April, we were having holidays, and then I thought, why not, hitchhike on one of these trucks and go to my uncle's place for a holiday. I was so excited. I told my parents. They thought this guy is crazy. When will the truck come? Who knows? So anyway, let him try. So in a bag I had a pair of clothes. I sat in that kirana shop every day waiting for a truck to come. 1, 2, 3, 4 days, nothing came. But I still wouldn't give up. I sat there very religiously, and luckily for me, on the 7th day, 2 trucks arrived. Wow. Yes. And I just jumped onto the truck and went down to the temple, had the puja, and then I went along with the truck to my uncle's house for the holiday. There, of course, I was there with the children. They were also having a holiday, and they were all playing around and all. Then my uncle decided to go to Tirupati. And since I was there, he said, come along. And he usually goes to Tirupati along with a few friends of his, so 3, 4 cars. And first stop was in Bangalore, Woodlands Hotel in 1963. And suddenly he saw his friend taking his son somewhere. He said, where are you going? He says, I'm going to put my son into a school here. Which school? He said, Baldwin's. Then he looked around and I was playing, running around there. He said, okay, come, why not? I put this guy also. And he just held me by the hand. He said, let's go. Put me in the car and took me to Baldwin's. And then they just put me in there. And they asked me if I knew anything, A, B, C, D. I didn't know anything. I was in a Kannada medium. They said, okay, I'm sorry, although he's 10 years, we'll have to put him to first standard. So in Baldwin's, I was put into first standard at the age of 10. But you won't believe, Kamini, it was a cultural shock for me. I'm from a remote village, eating ordinary food, ganji and other things. Suddenly I'm put in a European school in the hostel where there's bread, butter, jam and all the spoon, fork and all. It was a cultural shock for me. I couldn't just manage. The food itself was so nauseating. Actually, I wanted to run away. So every day I would go stand besides the gate of the school and hoping for my uncle to come back from Tirupati to see me if I'm doing well. But he never turned up. So I had no option but to, stay back and learn the tricks.
Your father didn't say anything?
My father is not even aware that I was put in here, I think. He is not. At that stage, I didn't know how to write letters. And maybe, I don't know, my uncle must have written a letter and later on told him that we have put him into school. I don't know how he came to know that I was missing. So, ultimately, I got used to school. And fortunately, that first year, I did well. I mean, I was 10 years old and then I came first in class. They said, since you're old and you come first, they gave me 1 double promotion to 3rd. Then again in 4th standard, I came first and they gave me 1 more double promotion. So I saved 2 years. So that I saved 2 years. So in 1970, I graduated from there. But by the time I graduated in an international school or what you call European school, we had people from all over the world. So I had learned, how to cope up with life and the games, and I played football, hockey, and I was a school captain and all that. So I was just thinking back, I said, if, from the journey I started in a small village, if I can come and compete in a European school, an international school, and, reach these great heights, anything is possible, I thought.
Absolutely.
Everything, that's what came into me. That gave me a lot of confidence. From there, of course, I did my PUC in St. Joseph's College. Then I decided that no more playing around, I have to study very hard, I wanted to do medicine. Then I wanted to get a merit seat, but luckily I did very well in my PUC and I applied to Bangalore Medical College, I got a seat there. Then after completing my MBBS, again I did my MS there. So that's how I became an eye surgeon.
No, excellent, but why did you take ophthalmology?
That again is by accident, Kamini. Everything seems to be by accident. Actually, ophthalmology was not my goal at all. I never really had. We had a professor called Dr. K.G. Das.
Oh,
you must have heard of him. Excellent professor. I was a big fan of his. By his influence, I thought, maybe I'll become a physician. I wanted to, become like him. But after I finished my MBBS and housemanship, that first year I could not get a merit seat in any specialty for post-graduation. Then I went to Pondicherry, did some 2 years, a few months, 5-6 months of senior housemanship and then. And then my uncle is very fond of me, same uncle. He said, no, I'll get you a seat. So he got me a seat in Manipal, Bangalore. He spoke to the PIs and they promised a seat. And so they said, first you do 1 year senior residency. Senior residency is equivalent to first year MS, And maybe next year we'll take into MS, they promised. But after I finished my senior residency, somehow they could not accommodate me in MS. But luckily for the second year, but the senior residency they offered was in ophthalmology. It was not my choice. They said, we will give you ophthalmology senior residency, you do, and you will continue as second year MS next year. It was offered to me, not that by choice, I didn't ask. I said, okay, I just took it up because I had no choice. So, but luckily next year, although I couldn't get a seat there, I got a merit seat in Bangalore Medical College again. So and that's how I became an eye surgeon.
So all this is providence.
Yeah, it's all providence.
That's great,
that's
really great. So
right,
I mean, you just flowed with time.
That's it.
And you were able to do what you have to do.
That's
do you ever regret it though?
Definitely not.
No.
Oh my God, definitely not. If I were to go all over again, I'll follow the same path. Because what I see is that, this path has given me so much. First that, it made me very strong. Say if my parents, if my uncle were my parents, maybe I wouldn't have been fighting so much and, studying so hard and all. He was well-to-do, he could always buy me a seat and I wouldn't have that hunger and that passion. So that made me strong. Then again in the school, I realized, as I told you, if a boy from a small village can come and be the head of that school by the time he passes out, that means I have the capacity to do anything. I thought the road that I have covered is huge. So I said, anything is possible. So that gave me confidence. Then once I went into ophthalmology, I told you it's by chance. Then I said, no, let me do the best here. That's all.
Excellent. Because I feel that some things are just, just are expected to happen, that's all. And then, you just flow with it. And some things, whatever you try, you will not get it.
That's right.
But when it is something that by the hand of God, that you are expected to do so much of service, and to the extent that even Dr. Rajkumar pledged his eyes with you people. So it only goes to show that how much you've made a name for yourself, and that people have all come from every walk of life, and then they come here, be it a politician or police or a public, they all get the same treatment in your place. And this is what I have liked about it. It's almost like a Tirupati Betta kind of line that people come in over here. And that's the beauty of it, with the eyes. They come there, they get themselves tested, then they go back. So in a way, the best example of McDonaldization of a service is in ophthalmology. And I feel that there is a moving line at every stage. It's not about just sitting waiting for one doctor to do everything possible. And by having different doctors, a mistake in one doctor can be picked up by another doctor. So somehow it sort of blends very well. What has your experience been? Having one doctor to see the patient, anterior chamber, posterior chamber, cornea, everything, to having different people seeing everything. What has been the difference?
Well, Kamini, before I go into that, since you mentioned Rajkumar's name, I must tell you the kind of influence he had on me. I've been a big fan of his actually from my school days when I was in Baldwin's. There usually, once or twice a month, weekends, they allow us to go out for a movie. Of course, we have to go with our uniform, tie and all, you know how it is. And all the people used to, walk down to Brigade Road and all those things, a lot of English movies playing there, all those Rex and all those theatres, so they're walking distance. But I was so fond of Rajkumar that along with another friend of mine, we used to walk all the way from Hosur Road to Majestic to see his movies. Those were the days of, Rowdy Ranganna, Bidi Basavanna, Bhagyada Bhagilu, his 100th movie and all that. Big fan of his. We used to walk all the way and walk back all the way. So from those days I was a big fan. And even during my medical college days, I used to see his movies almost first day, first show. That was the craze. And I always dreamt at some stage I must meet this man. That was a dream. I must tell you one thing that I don't know, somehow I'm a dreamer. And now I recently came to know that, that's one of the very effective ways of achieving things. Actually, even regarding this school, when my uncle's children used to come to my place for holidays, they had already joined all these schools. I used to see them running around and speaking in English and all. Then I used to dream actually of myself going to that school, such kind of a school. That is the only thing I used to dream, okay, one day I should also go to such school. I had a dream, and that dream came true. Then again I had another dream, I must meet this man. I don't know how, but I must meet him. And during my college days, medical, when I was doing my MS, you won't believe, when we were doing this corneal transplant, we needed eyes. And the eyes, all the eyes used to come from Sri Lanka. So I inquired why all the eyes come from Sri Lanka. Then I came to know that this eye donation is very popular in Sri Lanka. Most of the population there are Buddhists, and Buddhists have a faith that after they pass away, if some organ is donated, they get moksha. So much so that as soon as anybody dies, they'd like to donate their eyes. And there are so many eyes, excessive eyes, that they could not use. They are not only giving to India, they are giving to about 100 other countries in the world. So they were supplying the whole world with the eyes. Then I thought, well, Sri Lanka maybe has the population of Bangalore. Bangalore, so many people die. Why aren't people in Bangalore donating? I got this idea of, somehow we must start an eye movement, eye donation movement in Bangalore. But I thought, you need a very big personality, very popular personality to do that. And at that point, I couldn't think of anybody else but Rajkumar. So then I had another reason to chase Rajkumar. First, he is my idol, role model, and then I wanted to get him into this thing. But I didn't know, Rajkumar, it's not possible to approach him. But I must tell you this small story. When I started my clinic in Devaya Park, of course that was in 1982, December, and then maybe 4 or 5 years after that, I used to have my clinic 9 to 1, and then I used to take lunch break. I used to stay right on top. Then by 4 o'clock to 8 o'clock, I used to have my clinic. And when I was taking my lunch and about to rest, somebody knocks at that door. And then I said, yes, what's this? He says, sir, can you do me a favor? I said, what's that? He says, Dr. Rajkumar would like to have his eyes tested. Can you please come and do so? I couldn't figure out who this was. Then I said, well, I'm sorry, see, now I'm closed. I'll open at 4 o'clock. If he comes at 4, I'll definitely see him and do what's needful. He said, sorry, sir, if he comes at 4, there'll be crowd and there'll be commotion. I said, why should there be a crowd commotion? He said, sir, this is that film actor Rajkumar I'm talking about. I was shocked. I said, here he is. My hero wanting to see me, and I'm saying no. I ran down. I said, bring him along. I opened the shutters of my clinic. It's a small clinic that I had. It's a two-room clinic. It's a one-man army with two-room clinic. They say I was alone. I opened the clinic and I waited, and there he comes. He came with his son and this relative of his, and then he said, doctor, I have broken my glasses. I need a new pair of glasses. I do the test and I do all the other examinations, and then he said, we had an optical shop also close by. That was also shut at that time. I called that boy back and he came, he opened the shop. Then I told him, bring some frames, tried frames and all that. So I was sitting with him for almost 45 minutes to 1 hour. And he was sitting so quietly and so nicely he was speaking to me. So impressed. So that was my first meeting with him. And so after that, when I moved to the current place, Rajaji Nagar, next to the ISKCON temple, my another intention was that Dr. Rajkumar must inaugurate it. How to get to him again? Of course, after that, I really didn't have much interaction with him. But anyway, once he has met me, then somehow I was able to meet him. Then, of course, he knew me, that he had come to me once. Then he agreed to inaugurate it. So he inaugurated the current premises in this thing in 1993. After that, of course, maybe in a month or so, he gets his sister for cataract surgery to our place. Unlike these days cataract is a daycare center, we just operate and send them home. Then we used to keep them for a day or two. So when she was admitted after surgery, he comes visiting her. Then when he was in the room there, then I got a chance to talk to him. Then I told him about this eye donation movement and why we are not getting eyes here, how people are, suffering in blindness just because of want of eyes. And that is done after death, and then that can give sight to not one but two. But people are not coming forward because there is no awareness, and I want help from you. He said, doctor, this is a very noble cause. What can I do for you? I said, I don't want anything, I only want your name. I said, I want to open an eye bank in your name, Dr. Rajkumar's name, and I'm sure with your support and blessing it will grow and people will become aware. He said, definitely, that's, for this such a good cause, I'll not say no. And very next, within a few months, we opened the Dr. Rajkumar Eye Bank at Narayana Nethralaya. He himself, along with his wife, comes and they open the eye bank. And there itself he pledged. He says, not only my eyes, my wife's, my children, everybody, we all pledge our eyes. And all along, wherever he used to speak, he used to talk about eye donation. Actually, eye donation movement got a big boost and awareness was created. But the biggest thing is that a lot of celebrities, they endorse eye donation. They say, I am pledging, you pledge, and all those. They come on TV and all that. But in his case, he not only said that, but they did it. As soon as he passed away, the first telephone call that his son, Raghavendra Rajkumar, was to me. And he says, this is what's happened, and Appaji was very particular that, we donate his eyes. So I go home, the commotion there was at that time. And with all that commotion, we were able to collect those eyes. And although next day Bangalore was burning, I could still call 2 people, have the eyes transplanted. And with that donation and with that popularity, all over the state, eye donation became very, very popular. So I must say, thanks to Rajkumar, this all happened.
Oh, that's great. In fact, I always feel, see, there is so much that you can do. We always, curse film stars saying that they cause a lot of commotion, the traffic jams and this. I know you have Rajkumar here who's done such human service. In fact, I've had a lot of encounters with Dr. Rajkumar and his family, and they are very, very simple people, as I have noticed. And besides, when he dons the paint on his face, he's a totally different person. But without the paint, he's absolutely different. I mean, I can't believe it. Is this the same person? Yeah. But we'll move on to the next thing. I've always thought 2020 was only cricket, but now 2020 vision. What does that mean to you?
2020 vision means actually that is 6x6 vision was called 2020 vision. There's another way of saying. And another way of saying 2020 is it's perfect. But unfortunately, our 2020 has been totally other way, imperfect with this corona coming in. That's a very unfortunate thing that has happened. Actually, in ophthalmology itself, not only India, but whole world, WHO had a vision for 2020. Actually, 5, 10, 15 years back itself, they said a 2020 goal. That was the thing. Okay, we should achieve so much of the world must be, blind free, and so much of cornea must be collected, so much of surgery must be done, all these things. But very unfortunately, 2020 has been actually a black year for all of us. You know how it was for the whole world. Absolutely. But then we don't know. I accept it. The whole thing is I accept things as they are. Maybe there is a bigger picture that we cannot see, why things have happened. All we have to see, we have to accept it, and then from a point of acceptance, do whatever best we can. That's the only way to go. And of course, whatever precautions we need to take, we need to take. That's my feeling.
That's a very important thing. We've seen a lot of technology in ophthalmology, like of course other subjects as well. What has impressed you most in ophthalmology? The technology part of it and the innovation part of it, what has really caught your eye?
For me, actually, most dramatic is cataract and cataract surgery. Mm-hmm. Yes. It is almost a miracle. A blind man comes in, he can't see a thing, especially if his cataract is mature, and we operate, and the next day, he sees the world as though, it's fresh and new. Yeah, it's just magical. No other disease. We can give this kind of result, a miracle as though. So, and the best part in this cataract, of course, initially when I was a student 30, 40 years ago, the results were not that excellent. Although when compared to other surgeries, it was good. But, in eyes, it is such a delicate organ. If a small mistake happens, they could even lose their eyes. And that's very tragic. But then, technology has improved so much that now we can almost say that 95 to 99% we could assure them that they will have good vision, provided they do not have any other complication in the eye, like diabetic eye problem, associated issues are there. If it is a simple plain cataract, 99% that assure them they will get. And technology has improved so much that we can do eye surgery. Unlike my days, we used to give injection, we used to do stitches, we used to bandage them, we used to bandage both the eyes.
And then put black
Black glasses, that's later. We used to, when I was a student, we used to bandage both the eyes and almost tie them to the bed, for 7 days and ask them to eat only ganji, don't eat anything hard, because we are worried where the wound will open up. All these things were there. Now the technology has improved so much. We don't give injections, we have no stitches, we have no bandage, we just do the surgery. It hardly takes a few minutes, 5 minutes, 10 minutes. Even the latest technology, it's a micro incision, and it's so precise that almost he gets back 95% of his vision the very next day. He walks in and it's a walk-in, walk-out. I told you earlier days we used to keep them for a few days at hospital.
Absolutely.
Today is just walk-in, walk-out. In our hospital we do 100 surgeries every day. And at the end of the day, there's nobody in the hospital. It's a daycare center. They all go home, they come back next day, we see them, they are happy, we are happy, especially in cataract. I can't say this of other surgeries in the eye. In cataract, the results are so good. And the best part is, the 70% of the blindness today in our country is reversible because it's cataract. And it is reversible by such simple surgery. See, corneal transplant, as I told you, there is a limitation. Unless somebody donates their eyes, we can't give them vision. Here it's not like that. There is no limit. Any numbers we can do if we have the infrastructure, and we can give them sight. So this 70% of blindness, we say it is needless blindness, because it can be operated and we can do something for them. That shouldn't be. So this cataract surgery is one thing that we have to, that's a low-hanging fruit as far as our country is concerned. We have to go at it. Of course, we have been doing great work. The numbers because of cataract blindness has come down significantly, but we need to do more, because the whole problem is, India lives in our villages. 70% of our population is there. But this is one thing, any small thing they can go to the village doctor, but they can't go for eye surgery there. Eye surgery needs specialized setup, so they need to go to a bigger center. They are poor. They need, and it comes to aged people, so they need assistance. They need to his son needs to stop going to his work and take him to a bigger place, get his eyes tested, and it's not free everywhere. Sometimes it's expensive. So these are things that are stopping them from getting it. I feel that somehow we must get to that root of it and give this facility to all. The facility must be available, accessible, and affordable to all, so that we can totally get rid of this cataract blindness, which we should, because it is a reversible kind of a blindness.
I can see the passion in your voice when you talk about it. So you approve of camp cataract surgeries?
Yes, the way we were doing camps when I started surgery, we also had a camp unit. We used to move around, go to schools and screen and operate in schools. But now it's no more that way. We have realized that the results were not that great. So it's better to screen them where they are, bring them to our hospital, do the surgery in a hospital setup, and drop them back. That's the kind of camps that we are doing now. But definitely this kind of camps has reduced the cataract blindness load. But for this mass type of thing, it wouldn't have been possible. So these kind of camps are definitely giving us good results, instead of doing in schools and temporary theatres and all those things. But I feel we need to do even more. Yes.
Really interesting to note, but then trying to just shift it a little bit more. You said diabetes, okay, and you said diabetes can cause cataracts, so that those are the comorbidities that we see, and hypertension coming in because of the stress, and then the kind of junk food people take, and that's also one of the causes for diabetes, obesity, and things like this. And a person like yourself, okay, you have an interesting story to tell me about the diabetes and how you managed to get through diabetes, because time and again we've always heard people talking about diabetes means don't believe in anything that is natural. You must go across to your physician and you must get onto oral hypoglycemics or in the insulin. And you've had a very different experience, and being a reputed ophthalmic surgeon, what is your experience about the whole thing?
Well, Kamini, I must tell you that I was detected a diabetes at the age of 40. Okay. Well, then I accepted it. My parents, both of them had diabetes, and I said maybe it's hereditary, it's genetic, natural that I get it. So I accepted it, went to a physician, got myself tested, and he gave me a tablet. But what I realized that as years went by, my number of tablets for diabetes kept on going up. That means I was going downhill. It was not helping me. So much so that at the end of around 20-25 years, I was taking 5 or 6 tablets for diabetes and still not getting it under control. So even for a year or so, they put me on insulin injection. And along with that came so many other problems, like bad cholesterol, I had kidney issues, I had heart problems, I had bladder problems, I had prostate. So much that just till 2 years back, I was taking 12 tablets every day to control these things.
So what else would you eat?
Yeah.
That itself would be your diet.
Yes. So I see what I was just thinking. Actually, I am quite a disciplined type of a person. I follow instructions by the doctor or the authorities or the guidelines that they're given, and following those regular guidelines for eating, and plus doing regular exercises. I used to play all the time. I used to regularly exercise. I used to meditate. I used to keep my stress low, but still things were getting from bad to worse. So I thought there has to be something wrong. Or maybe primarily then I thought maybe there is something wrong with the advice itself. So then I started searching, digging a little more deep. And especially during this pandemic time, I had a lot of free time on hand. Then I realized that diabetes is basically a dietary disease. Dietary disease means there is something wrong in what we are eating. And then I found out, of course I am a non-vegetarian, although, so I used to eat all the time, anything that is tasty. So I really didn't think that diets mattered so much actually. So I thought, eat what you want, follow doctor's advice, exercise, and maybe keep your stress low. That should be enough for a good, healthy life. But that wasn't the case. So then I said, first I actually read about veganism. So I gave up all the meat, I gave up dairy, and I became a vegetarian and followed it. But since that is also a disciplined diet, that also gave me some good results. I lost some weight, my sugars came low, and some tablets were reduced. But one thing I noticed that somehow, diabetes tablets were not completely going away. And then my triglycerides, my cholesterols were quite bad, and liver had some issues. So I started doing some more reading. Then I came across what's called a low carbohydrate, high healthy fat diet.